Boa tarde a todos, sejam muito bem-vindos, sejam muito bem-vindas ao webinar do Consórcio REDCap-Brasil. É com grande satisfação que nos reunimos mais uma tarde de quarta-feira para falarmos sobre o REDCap. E nessa tarde temos aí um tema especial que é muito atual, que é o Twilio e o MyCap. São dois temas que nós nunca tivemos a oportunidade de abordar de maneira separada. Então, espero que vocês aproveitem bastante este conteúdo. Mas nós temos uma convidada de honra também neste webinar. Esta convidada é Amanda Miller, da Universidade do Colorado. Vamos falar um pouquinho sobre ela, só para que vocês a conheçam. Vocês estão vendo aí a Amanda. Amanda é muito reconhecida no Consórcio Internacional por ser normalmente a pessoa que ganha os prêmios dos melhores materiais de treinamento. Ela é muito famosa por desenvolver vídeos, tutoriais e materiais de treinamento no Consórcio REDCap Internacional. Uma outra coisa que eu preciso contar para vocês sobre a Amanda, ela foi, em 2018, a pessoa eleita como MVP do Consórcio Internacional. O que seria isso? A pessoa mais importante naquele ano, que foi a mais atuante, que mais ajudou a comunidade. E aí vocês veem a foto dela recebendo o prêmio e o Paul Harris fazendo a entrega deste prêmio para ela, né? Então foi muito gratificante ver este fato acontecendo, né? Se consolidando. Amanda também veio ao Brasil. Nós tivemos a chance de conhecê-la, de apresentar, né, o nosso país para ela. Então está ela aqui um time internacional, olha nós aqui também do Consórcio REDCap Brasil, do congresso que aconteceu em 2018. Fiquem totalmente à vontade para escreverem as perguntas de vocês em português ou em inglês, tá? A Márcia vai transmitir todas as perguntas e dúvidas de vocês para a Amanda. E depois, ao final, nós podemos, inclusive, abrir o microfone para que também, caso alguém queira fazer uma pergunta de uma maneira oral, tá? Fique também à vontade. Espero que vocês aproveitem bastante esse webinar. Agora, sem mais delongas, a Márcia e a Amanda vão conduzir aí o webinar. Muito obrigada.
Boa tarde a todos. Good afternoon, everyone. Amanda, the stage is yours.
Thank you. Can I share my screen? I think Katya still has.
I need to change it here just a second.
Thank you.
Now you are the presenter and you can share your screen, please.
Obrigada.
Welcome.
Hi, everyone. Thank you for having me here. I am the REDCap administrator at the University of Colorado, and I am so happy to be able to talk to you today about Twilio and MyCap. Twilio and I do not know how to make that go away. All right, we'll ignore that. Twilio and MyCap are two ways to make REDCap more accessible to participants who may not have great computer access, or where taking things via email is just too complicated or doesn't work for some reason. And there are things that we've found that have been really nice for us to expand access of REDCap. So Twilio is a way of sending survey links via SMS text messages. And it also lets you take surveys as a voice call, where it reads questions to you and you hit the number on your phone to answer multiple choice questions in a survey. And it looks like this on the phone, just an easy message and a survey link. It's pretty cheap, but it's not free. It's a third-party service that works with REDCap. So using Twilio, the first thing you have to do is go to twilio.com and sign up for an account. And then you have to set up the billing. So you would go to billing, set up payment method, and then you can pay with credit cards or with PayPal. After you have set up your account, then you can buy a phone number from Twilio, and this is the number that you'll use for the voice call or for the text message. And you have to have a different number for every project. So you would go to phone numbers, buy a number, and then you can actually choose what country you want the phone number to be from. So I can set my phone number to be from Brazil. With Brazil right now, they only have voice calls. So if you want to send text messages, you would need to get American or another country that has text and send from that, which is probably a little more expensive for the text message. If the message is just you to the participant, then that's something that you would figure out if you can afford. It's more expensive if you need the participant to text you back, but usually you don't do that. Beg pardon? Usually it is just you messaging the participant. And then there is a monthly cost for the phone number that you rent from Twilio. After you have your Twilio account set up, then in REDCap, you would enable it on project setup under optional modules and customizations. And you'll have to pull your account information from Twilio into the REDCap project and give them the phone number. And then there's one more step you have to do to get them linked up, and that's to disable this request inspector. That's under programmable voice and settings. The request inspector is a tool Twilio uses for debugging when there are problems. But the problem is it stores the information that you send from REDCap to the participants on Twilio's server for 90 days, which is helpful for debugging, but it means that people's information, their phone numbers, are on a third-party server. So REDCap makes you turn that off so that the data only stays on Twilio's server for a few seconds while it's sending the message, and then it is completely deleted. Once you have Twilio turned on, then you're going to set it up inside of REDCap. So you'll want to choose your survey invitation types. You can send survey invitations as a link via text message. You can do voice calls. This can initiate the survey as a voice call or send an invitation to take the survey as a voice call where the respondent calls Twilio. Or you can send survey invitations to take the survey as a voice call where they get a call from Twilio after they respond. You can even do the survey as an SMS conversation, but this has some privacy concerns because any health information that they respond gets saved in their text messages, not just on REDCap, and that can create some serious privacy issues depending on what you're collecting information on. You can choose your default invitation preference. So for the project, do you want surveys to default to sending as an email, and sometimes you send them as text messages? Or do you want them to default text message and then sometimes you can choose to send as an email? And then just like if you're sending a survey, you can pick an email field and use that email field for the participant list to link them. You can do the same thing with Twilio and a phone number. So you can choose a phone number field and that will populate the participant list, and REDCap will use whatever the participant or the researcher enters in that field as the phone number to use. And once you have Twilio set up, you can send it out just like you would send out any other survey. So if you're using the public survey link, you can invite the participants via a voice, invite the participants. So that's just at the bottom of the public survey link page. You can put in a list of phone numbers, and then you write the message that you want to send, and you have to have that smart variable for the survey link. The participant list is just like if you were sending it out with emails, only now you have a phone number column. So you can add participants with an email, with a phone number, or with both. And then you can set the preference. So for each person, you can say, do they want to get surveys as an email, as a text message, or as a voice call? And you have to go in on the participant list, and for every person, you have to choose which one you want it to be. You can't create a field in REDCap and say this is going to be their preference and have it link. You have to go in and do it manually for everybody, unfortunately. With automated survey invitations, the only difference with Twilio is that now you have to choose the invitation type. So for every individual survey invitation, you can choose if you want it to be an email, text message, voice call, or if you want it to use the participant's preference, whatever you set on the participant list. So who's using Twilio? We have a lot of projects using Twilio. It's very, very popular here because it's not very expensive, and it's an easy way of reaching people and giving them more options of responding. So some of the most common studies we have are anybody trying with teenagers. Teenagers and people in their 20s and 30s and sometimes 30s are much more likely to respond to a text message than they are to an email. It's just more natural, they get better responses. It's also good for participants who don't have computers. They often find it's easier to deal with text messages than it is to deal with emails. And studies where the participants can't read very well, either they don't know how to read or they have visual impairments, they're able to do voice surveys and have the survey read to them instead of trying to read the survey on the screen. With COVID, we have been using even more Twilio. A lot of studies that were in person are online now, and participants want to be able to respond, to receive things via text messages and respond that way. So we have a lot of new studies using it this way. It's also nice with telehealth. So if a participant is using their computer to video with the doctor or with the researcher, it can be kind of confusing for them to then go and try and find their email and open a link on the computer. It's easier for them to often to use their phone. So if the doctor wants to send them a survey to fill out while talking to the doctor, they can send it via text message and it will come up on the person's phone and they can talk while they're filling it out. We also see it in operational projects. So a new one that's starting for us is employees complete a screening survey before they come into work. And it says, green, you're healthy, come on in. Red, don't come in, stay home. And often maybe get tested for COVID. Or yellow, where they need a follow-up. So Twilio can help with those follow-ups where it's easier for the employees to find the text message. They're better at remembering to do it. And it's easy for them to pull up on their phone if they're talking to a doctor or a screener, helping them with the project. Are there any questions on what I showed with Twilio?
We have one here from Fernanda. Is it possible to send text message also using WhatsApp by Twilio or only using SMS?
It's only SMS, I'm sorry.
Somente SMS, Fernanda. And Amanda, do you know the average cost for Twilio by month? Just so we can have an idea.
It depends how many text messages. So in the US, phone numbers are $1, and then a text message is 0.0075. So 3/4 of a cent per text. So very cheap. I'm not sure. It would have. I couldn't check the prices for Brazil. I tried.
Ok. Let me just translate to the audience. Eu perguntei para ela se ela sabe um preço mais ou menos, quanto custa, na verdade, por mês, né? E ela falou que nos Estados Unidos a conta, né, a linha é $1 e o preço é por mensagem, né, por SMS, que hoje está 0,075, né? Então, esse seria mais ou menos os preços que eles têm nos Estados Unidos. Hoje a gente sabe que o dólar está um pouquinho mais alto aqui para a gente, então acaba saindo um pouquinho mais caro a depender aí do volume, né, da quantidade de SMS que tem que ser enviados para os participantes, né? We have another question over here, Amanda, from Alessandra Kodama.
Using Twilio for to receive notifications. Yes, you can use it with the REDCap alerts and notifications. You can use Twilio SMS text message or voice call to send and receive notifications in REDCap.
A Alessandra perguntou se é possível utilizar o Twilio para receber notificações, e é possível, né? A Kátia até colocou aqui que aqui no Brasil a linha de telefone é $4, tá? Cada número, né, de telefone. Alguém tem mais alguma pergunta? Is there any other question regarding Twilio?
Amanda, I just want to know, as in Brazil, we don't have SMS or WhatsApp available. When you are using the phone number, we should pay the tax applied internationally. Is that correct?
It will probably be an international rate. So okay. Tax will be a little more expensive in Brazil.
Yeah, today I was checking the price before our webinar, and I saw that you only still have the call service, not the SMS or WhatsApp. And then I figure out that probably we need to buy a phone number from the United States, for example, and then to pay the tax for SMS or WhatsApp that is taxed in the other country. Is that correct?
I think so, yes.
Okay. And about WhatsApp, there is still not available, because in the Twilio website, I can see that there is the WhatsApp model.
Oh.
Yeah,
okay.
They have.
Yeah, I have not seen WhatsApp used with Twilio. But if they're working on a model for it, that's fabulous.
Yeah, and also they show something related to Brazil, because I think we are the most, the people that most use WhatsApp in the world here in Brazil. We use much more WhatsApp than SMS. I'm gonna check, and if I found the hyperlink, I'm gonna share with the audience just for them to check that out.
Thank you. I tried to get on Twilio but I couldn't get a Brazil VPN working yet when I was trying. So I couldn't.
Thank you very much for showing us that you are trying to connect a Brazilian phone. Okay, thank you very much.
Yes.
I have two questions. One, so is that true? So did I understand correct that you need one phone number for each project?
Yes, one phone number for each project. Or if you close a project, then you can use the phone number for a different one.
Ok. Pessoal, só para reforçar, então é um número, né, de telefone por projeto, tá? A não ser que o seu projeto tenha encerrado, tenha acabado, aí você pode utilizar para um outro projeto. And the second question, Amanda, regarding the safety and the security, like how do you see there in United States regarding the security, as Twilio is a third part?
Yeah, we had our security team looked at this for a long time before we were allowed to use it. Data only stays with Twilio for a couple of seconds. So when you send the message, the data is on Twilio. So the phone number in the message is on Twilio's servers for a couple seconds until the message is sent. And once the message is sent, it is completely deleted.
Oh, okay.
And that's why you have to take that step of turning off the request inspector. If that's on, Twilio will save the data. So we have to have that turned off to use Twilio and REDCap. But because the data is only with Twilio for a couple seconds, our security teams said that it was safe and secure to send messages that way. We don't use the feature where we take the entire survey with text messages very often because we're worried about data security that way. If we're just sending a link, it is considered secure and safe for the patient.
All right. Eu perguntei para ela, pessoal, com relação à segurança dos dados, né? Visto que o Twilio é como se fosse um terceiro, né? Isso já foi bastante avaliado e é importante que seja desligado, né, esse request inspector, e quando é enviado a mensagem, fica no servidor do Twilio por milissegundos depois é deletado, né? Então existe essa questão da segurança, então as instituições estão ok para seguir com o uso do Twilio nas pesquisas, mas eles acabam evitando aí surveys, fazer, né, elas muito longas e completas, né? Então é ok eles fazendo essa utilização mesmo sendo um terceiro. Any other question? Alguma outra pergunta?
All right. I'll show some things about MyCap.
Sure.
All right. Let's see. There. So MyCap is another way of getting surveys to a participant. It is an external module. So your REDCap has to be able to use external modules to use MyCap, but it is made by Vanderbilt, and I think they want to start including it with the main REDCap. But for now, it is an external module that you have to turn on inside of REDCap. And then you have the module that the researcher uses, and then you have the app for Android or for Apple devices, and that the participant downloads onto their phone. It's cleaner and an easier way to do surveys, and it's really nice for surveys where the participant is filling out something every day or every week. They get a push notification when there's a new survey for them to do. So it's good for things like diet studies, exercise, sleep studies, where every morning they have to fill out a form on how they slept, or if they need to report vital signs like blood oxygen, pulse, temperature to the researcher. Most of setting up MyCap is in the module. So the picture is what the module looks like. You create the project there in the module, and then you can jump back and forth between the module and the REDCap project it creates. So you can see how changes you made in the module look in the project, and you can create forms inside of REDCap and then enable them in the module and set them up there. The first thing you have to do with a MyCap project is establish if you want to base everything off of when they install the app, or if you want a baseline date, some kind of date related to your study, a visit, or enrollment. And when the surveys will be available is based off of that baseline date. So that's the first question that you set up, and it's the first thing they see when they open your project. Then you set up your tasks in the module. Each task is a REDCap instrument. You can create the instruments in REDCap or in MyCap, but you have to add the questions in REDCap. And not all instruments in the project have to be in MyCap. I can disable any instruments I want, and they won't be available to the participants on MyCap. And then once you've enabled them, you need to schedule how often they show up for the participants. So you'll choose if this instrument should even collect data at all, or if it's only going to be in REDCap. And then you have questionnaire or form. Questionnaire format is one question at a time. And then the form is like a regular survey or data entry form where all the questions show up at once. When participants are looking at their tasks, you can choose if they see a % complete for each task, or if there's a chart that shows how things are over time. So maybe if it's a sleep study, you might chart how many hours of sleep they get a night, or for a weight study, you would chart their weight so that they can see what the progress looks like over time. And then you have your save choices. Can they come back and complete this on another day, or do they have to complete it on the day that you say? Can they save and come back later, or do they have to do it all at once? Once you have that set up, then you set up your schedule. So is the schedule going to be based off of when they install the project, or a baseline date like enrollment? How many times does the form show up for them? Is it one time? As many times as they want? Does it repeat on a regular basis? Or is it a fixed number of times, maybe 10 times? If it's repeating, you say if it should be daily, weekly, or monthly. And then if it's weekly or monthly, you have to say what day of the week or what day of the month it repeats on. You can set a delay. So maybe you don't want the form to show up right away. You want it to show up after 7 days or 10 days and then start repeating. So you can set how many days after your install or your baseline before the survey appears. And then you say, when does it end? Never after a certain number of times, a certain number of days, or on a specific date. After you have your tasks and you add your participants, you can add them in MyCap or you can add them in REDCap. If you add them in MyCap, you have a participant page with all the participants in your project. And then you can edit or add a new participant, or you put in their name and set those dates. And then you get this QR code. And the QR code is what the participant will scan, and that links them in the MyCap app on their phone, that record to their record in your project specifically. You can also add people in REDCap. Every MyCap form is also a REDCap form. So you can add people like you would with regular data entry, and they will show up on the participant list in MyCap. You can get the QR code there. MyCap uses special action tags to link forms in specific fields in REDCap to specific fields in MyCap so that it knows first name. This links to the participant first name in MyCap. And this is what MyCap looks like to the participant. So every day when they open it, they'll see the calendar and then what tasks they have to take that day. Inside, when they open a task, this is a questionnaire, so they just get one question at a time. It looks like any kind of question. And then when they're done, it will tell them how complete the task is and show them any other tasks they have. MyCap also lets you message with participants. So participants see a message link where they can message with the researcher, and the researcher sees it inside of the participant in MyCap. So up here on the participant page, I can link to the message. I can see the messages that I have with that participant. It also has really good support features. It makes it very easy for the participants to contact the researcher. The researcher puts an email that they want the participant to contact them with inside of MyCap, and they can just click on that and send an email. You can also have helpful links for MyCap. So these could be your study web page, or web pages that have helpful or important information about the thing that you're studying. And then participants can have more than one MyCap project. So they can switch from your project to another MyCap project that they might be part of inside of the app, and everything's linked very directly. A special API for each project, linking their record to that specific project, and they can just switch between them. What it looks like in REDCap is just regular data entry forms, and then every time a participant completes a task in MyCap, it's another repeating instance in REDCap. And you can still do data entry in REDCap for the participant, even on forms that they would also fill out in MyCap. So if they make a mistake in MyCap and they need you to go in and fix it, you can do that for them if you need to. And then MyCap has special fields that it adds for every form that is a task in MyCap. So we have a few projects using MyCap. It's growing. It's still growing. It's still pretty new for us. One project we have is a mental health project where participants need to fill out screening questionnaires on a very strict schedule. And they fill them out once a month or once every 2 weeks, depending on the project or depending on the questionnaire. And they found MyCap to be a really smooth way of getting those surveys to their participants, and their participants like using MyCap. It's a little bit cleaner and easier for them than dealing with a lot of different surveys coming to them. We have a study looking at a specific lung disease where they need participants to give them blood oxygen levels on a regular basis and to fill out surveys about how they feel several days a week. And again, MyCap it's smoother, it's more streamlined, it's easier for the participants to fill out regular surveys like that. And then we have a dietary study where take pictures of their meals in MyCap, and that is uploaded to the REDCap project. So the researchers can actually see the meals, the before and after pictures of the meals the participants are eating. So they don't have to rely on the participants guessing how much of something they may have eaten. And then I have some links here. I'm happy to email this out, or if Katya or Marcia can send a copy of the presentation. These are videos I've made that show me using Twilio and MyCap with live demonstrations. I'm sorry I couldn't do MyCap as a live demonstration so you could see it on the phone, but the video I have here shows what it looks like in real time as I'm answering questions and filling out surveys on it. That might be helpful for people. And are there any questions I can help with MyCap?
And we have a couple of them here. So Luis Felipe was asking if MyCap is possible to send alerts to remember the participants to take the study drug. Can you just show the message that they can send?
So it would show as a task. You could have that task just have a descriptive field that says, take your medicine, and have the participant click done to complete it. So you could make that work, yeah. It'd be a little bit different.
And what is your opinion about the user's experience with MyCap?
Most people seem to like it. It's neater and easier when there are a lot of daily surveys to fill out. To open it, to get that push notification, time to take your survey, and open the app and just answer a couple questions. And opening your email, opening the survey, dealing with the browser. People seem to like it.
It's very amazing, MyCap. I had a chance a few months ago just to try and see the demonstration, and the types of activities that MyCap allows is like amazing. Cognition, vision, motor functions, fitness, speech test. It's very, very nice.
Yeah, a lot of those are Apple. They use an Apple research kit, so you need an iPhone to do them, but they are amazing.
It's very, very nice. We have another question here. How much memory does the app require?
Oh, that's a good question. I'm not sure. Let me see if I can see that. About 43 megabytes, it looks like.
I have no idea. Is it a lot? It's not that much.
Not big.
Small?
Not big.
All right.
It's not a big app.
Not much. And also the question, can I have forms for several participants in a sole MyCap, for example, for mother and child?
That's a good question. If they are the same record in REDCap, then you can. If they are different records, then it wouldn't work well. You would want 2 devices.
Between mobile app, MyCap, and Twilio, which one would be your favorite? I know they work different, but do you prefer any of them? Like between three of them?
That's a good question. Twilio is used the most for us. It's the one most people are using. I like MyCap more than Twilio, but you have to learn to use it. It's the module, the MyCap module. It takes some time to get used to it and to be comfortable setting up forms and tasks, but it looks nicer when you're done.
Yes, I agree. Isadora is asking how to have access to the external module, the MyCap external module. Only the REDCap admin.
Yeah, you have to have your REDCap administrator has to turn it on for you.
Isadora, o administrador do REDCap da sua instituição tem que habilitar para o seu projeto, né? I'm just gonna make a clarification for them, the difference. REDCap mobile app, Twilio and MyCap. É diferente, né? O mobile app, o aplicativo do REDCap com o Twilio e o MyCap, eles são funcionalidades, né, assim, do REDCap diferentes. Vamos dizer que o Twilio e o MyCap, ele é muito mais voltado para o paciente mesmo, que é o paciente que recebe a mensagem, né? É o paciente que tem um aplicativo. Agora, o mobile app, ele é um aplicativo gratuito do REDCap, porém ele é para uso do grupo de pesquisa, né? E a grande estrela, né, a funcionalidade do mobile app é permitir também a coleta offline, né? Então, existe essa diferença entre os três, né? Tanto os objetivos como os usos, né? Então, só para fazer esse parênteses aqui, né? Let's go ahead with our questions. I guess for our patients, this is Katya. A cat would be very challenging. Yes. The problem is that right now everything is in English, and although we are working on the translation, here in Brazil would be very difficult for the patients to understand and follow the instructions in English. So
yeah, that's the hard part. We have a lot of people who speak Spanish, and it's still tricky with them too.
Understand and everything.
Yeah. But it helps that with MyCap, most of what they see is messages you write. So that would be in Portuguese, or for us it is in Spanish, but some things like the calendar and the next and previous, that's all in English for now.
I see. Ximena is asking for your links. Ximena is in the shared notes, notas compartilhadas.
Yep, I think I put them in there.
Yeah. Any other questions? Alguma outra pergunta?
MyCap is free.
MyCap doesn't need connection, or can I use it offline as well?
Good question. So you can use it offline, but the data will stay on the participant's phone until they are online. And when it syncs, it deletes the information from the participant's phone. So if it's a problem for that information to stay on their phone, they need to be online to fill it out. If it's okay, it might take a little time, then it can be offline.
Because if they are connected, if they have connection, as soon as they respond and they do the task, it goes directly to the server.
Yep, and then it deletes it from the phone.
Oh, ok. Então, o MyCap, ele funciona, né, sem conexão. No entanto, quando o paciente responde, né, de modo offline, os dados ficam no celular dele, né. Então, o ideal seria que ele respondesse online, porque assim que ele faz a tarefa, né, executa, isso já vai direto para o servidor e não fica armazenado no dispositivo, né? Any particularities regarding if the project is with using repetitive events or?
Yeah, that's a good question too.
You need to be careful of the design of the project.
Yeah, it has to be basic, not longitudinal. And it has to use the repeating instances to make new tasks when they finish each time they do a task.
Ok. Muito importante, pessoal. Para a utilização do MyCap, é preciso que o projeto esteja no modo transversal, né? Com o modo do eventos repetitivos, né, dos instrumentos repetitivos ativados, para que o paciente consiga repetir as tarefas, né, mas não pode estar no longitudinal, ok? Paula, she's thanking you for showing and the opportunity to learn more about Twilio and MyCap.
Thank you for letting me.